call with Doctor Pramila Kalra. So, Doctor Pramila Kalra will join us at 9 p.m. So, she'll be a bit late because she is a bit caught up today. So, until then, probably I and Jamal will talk to you about our transition experiences. So, Jamal, mm, how are you doing today?
I'm good. I'm good.
Yeah. So, yeah, one thing I know about Jamal is he's so down to earth and so soft spoken. So it'll require me a lot more to ask him. So, Jamal, like, if I can ask you, how did you discover that you were trans?
I think I knew it from the very beginning when I was very young that there's something different about me.
Hmm.
And when the internet connection came to India, I think around 2000, early 2000, then
Hmm.
I googled it and then I found out, oh, this is called trans. So that's how it happened.
Did you have anything to anyone to meet then? Like, did you know any other transgender people around, or how did that process go?
I didn't meet anybody till I was 23.
Yeah, that's quite late.
So that was a lot to say.
Yeah. So, hmm. Yeah, and what age did you come out at?
25.
25. So, who you don't have to name them, but how did you meet your first trans person?
So that was through Facebook. I connected with somebody from Facebook and we instantly became friends. It was like so much in common trans brotherhood. So we instantly became friends and we are still friends now. Very good friends actually.
Yeah, that's sweet. I mean, when we are alone, we are strange. When we are together, we are crazy. So that's the thing. Like, for the entire world, we are strange when we are just alone with the entire world. But when we are with each other, we go crazy and have fun. That's so okay. So when you came out and before this, you did your parents or family have any clue or anything? Did they know anything?
So I think when I was a teenager, I always used to tell them कि मुझे साइकाइट्रिस्ट के पास जाना है, मुझे साइकाइट्रिस्ट के पास जाना है, कुछ तो गड़बड़ चल रही है, दिखाना है. But that taboo which they had कि नहीं साइकाइट्रिस्ट के पास तो पागल लोग जाते हैं, ये है वो है. तो आई थिंक समवेयर डाउन द लाइन उनको थोड़ा बहुत आइडिया तो था, बट देन
Mhm.
या
या कभी सुना भी नहीं होगा इसके बारे में क्योंकि
या मेरे पिताजी का फर्स्ट क्वेश्चन यही था कि ऐसा कैसे हो सकता है कि
Mhm.
कोई इंसान अपना सेक्स चेंज करा सकता है या सो दैट वाज हिज फर्स्ट क्वेश्चन
Mhm.
व्हेन आई केम आउट टू हिम.
Yeah, I can imagine because from male to female, trans women especially, they are more visible than trans men. So for most trans, for parents, it can be who are not, who have nothing to do with this can be quite new. And but was it? How did you bring up? How did you even talk about such a? How did you drop the bomb? If I may ask.
So I think before I dropped the bomb, I started transitioning. So changes were quite evident, even though my family was in denial for some reason. So I told my father, I took all the documents जो भी मेरे पास डॉक्यूमेंट थे वो सब मैंने शो किए कि ये मेरा जेंडर डिस्फोरिया लेटर है, ये मेरा HRT का लेटर है.
Mhm.
So then I told him कि ऐसा ऐसा फील होता है, that I feel from inside that I'm a man.
Mhm.
So that's how I came out to my father. But he was मतलब एक बारी में he didn't really understood the whole thing. So I had to come out a lot of times to him. So then I think my sister was a very big help in that thing. उनके ऑफिस में देयर वाज अ ट्रांसफर में, नो ट्रांजिशन.
Mhm.
So that's how she actually made my father understand everything.
Mhm.
So then my father agreed कि चलो सर्जरी कराते हैं, ये करते हैं, वो करते हैं.
Yeah. And how much time this entire process did take? Because I mean, just from the first clue that you dropped at him to surgery karate hai.
I think 6 to 7 months.
Okay, that's quite fast actually. Yeah, yeah, that's quite fast. And how how did you get your sister on your side?
So my sister knew that from a very long time. She was like कि मुझे तो पता था तुम हो, तुम्ही को नहीं बताना था. She was something like that. So she was always on board with these things. So never had issue with her.
Okay. And what about your mother?
So my mother passed away before I came
Oh,
out to her.
okay.
So so
I'm
yeah.
sorry.
So
Sorry. Yeah. Okay. So how so did you know which doctors to see where you are? Um, did internet help you with that a bit? How to transition?
uh, internet as in like the internet community helped a lot actually. The online community that
Mm-hmm.
helped a lot.
Mm-hmm.
Where वहाँ पे आई फाउंड पीपल जिन्होंने मुझे डॉक्टर से कनेक्ट किया.
Mm-hmm.
एंड फिर जब लोग मिलते हैं तो उनके फीडबैक भी मिल जाते हैं कि ये डॉक्टर अच्छा है या ये डॉक्टर अच्छा नहीं है, इसके
Mm-hmm.
पास जाना चाहिए, ये जल्दी कर देगा या जो भी है.
Mm-hmm.
उन फीडबैक्स को लेके देन आई चोज़ द डॉक्टर कि इसके पास जाना है, इससे जीआईडी लेना है या इससे एचआरटी शुरू करवाना है.
Mm-hmm.
सो दैट्स हाउ इंटरनेट बिकेम अ गुड थिंग
Mm-hmm.
फॉर मी.
तो ये सारे डॉक्टर्स दिल्ली में ही अवेलेबल थे आपके लिए?
हाँ, सारे डॉक्टर दिल्ली में अवेलेबल हैं.
ओके. एंड जब आप अ, कोई ऐसा था जहां आप गए और डॉक्टर के पास आप गए और आपको लगा कि ये गलत है, यहाँ नहीं या यहाँ नहीं जाना मुझे वापस और यू चेंज द डॉक्टर?
So, when I came out to my father, so my
हम्म.
father is in defense.
हम्म.
So he was like कि चलो मैं अपने आर्मी हॉस्पिटल में लेके चलता हूँ. So that was a little. So the psychiatrists जो वहाँ पे थे, they were very trans friendly. So they
हम्म.
were like कि ये तो आपको आना ही नहीं चाहिए, ये तो ऐसे ही हो जाना चाहिए.
हम्म.
You should not need a letter from our end.
हम्म.
But then they referred to gynecologist and the surgeon. They were
हम्म.
very not so trans friendly. So the
हम्म.
surgeon started fighting with me कि अरे बहुत सारे rules होते हैं, regulations होते हैं, ये होता है, वो
हम्म.
होता है.
हम्म.
So and then he was like came to a natural and natural of all
हम्म.
these things.
हम्म.
So that was the point. I never want to go to that place again.
Yeah, I remember from my time, I transitioned in 2006. So in that time, when I was going to the doctors here, I had to educate them a lot. Like even because I had read more about trans issues than the doctors have ever read. And so I had to educate them a lot, especially in KMC. So यहाँ मणिपाल में जो hospital है Bangalore में, it's one of the top hospitals in India. So it's not like I went to a shady place or anything. So even the psychiatrists and endocrinologists, so endocrinologist तो है ही नहीं. So when I said, okay, so let me tell you. So when I started transitioning, first thing I knew was I'll need um okay, there's a question. I'll answer that later. So first thing knew was that from internet that I'll need a psychiatrist certificate. Uh, for what I don't know, but I need a psychiatrist certificate. So I went to a psychiatrist. First couple of psychiatrists, they were like really weird, asking me to do, like there was a lot of physical examinations, blood tests, etc. done to see if I have some intersex condition or if I have a tumor in my brain, etc. etc. वगैरह वगैरह. और उसके बाद जब मैं फाइनली एक साइकियाट्रिस्ट से मिली। वो केएमसी में थे, मणिपाल में। और उन्होंने क्या किया मुझे पता नहीं है क्या है, पर मैं समझता हूँ तुम एजुकेटेड इंसान हो और तुमने इसके बारे में बहुत पढ़ा है। तो हम क्या करेंगे, हमें पता नहीं है ये कैसे करना है, तो हम तुम्हें ऑब्जर्वेशन के लिए एक रूम में रख देंगे, हॉस्पिटल रूम में। अगर तुम पागलों की तरह चिल्लाते नहीं हो या किसी को काटते नहीं हो, एग्जैक्ट ऐसे वैसे, तुम लाइक नॉर्मल हो, तुम्हें डिल्यूजनल अटैक्स नहीं आते, तो पागलपन के अटैक्स नहीं आते, तो हम तुम्हें एक 10 दिन के अंदर, 10 दिन देख के सर्टिफिकेट दे देंगे। तो मुझे लगा ओके 10 दिन है तो ओके फाइन। तो मैंने सो आई वाज तो मैं वहाँ हॉस्पिटल में भर्ती हो गई 10 दिन के लिए। और उसके बाद 10 दिन मेरे लिए मुझसे बात करने के लिए कई पीजीज आते थे, साइकियाट्रिक पीजीज। और कई कई कभी कभी वो रिकॉर्डिंग डिवाइस भी रख के जाते थे कि मुझे पागलपन का दौरा ना आए कभी कभी। सो देन ओके दे डिड अ लॉट ऑफ दैट, एंड उसके बाद उन्होंने मुझे सर्टिफिकेट दिया, हाँ ये मेंटली स्टेबल है, ये डिसीजन कर सकती है ट्रांजिशन के बारे में। तो उस सर्टिफिकेट से मुझे हार्मोन मिला। तो अ, तो एक्चुअली काफी सारे डॉक्टर्स ऐसे हैं जो जो मुझसे काम ही नहीं करना चाहते थे मेरे साथ। और कुछ डॉक्टर्स ऐसे थे जिन्हें अ, पता नहीं था कुछ भी, पर वो मेरी हेल्प करना चाहते थे। तो और उसके बाद जब वो सर्टिफिकेट दिया उन्होंने, तो उसके बाद मुझे उन्होंने लाइक एक सेशन करने के लिए बुलाया फॉर ऑन ट्रांस इश्यूज। एंड दैट वाज आल्सो, वो भी काफी क्रूड सा सेशन था कि लाइक ये केएमसी मणिपाल में था, तो साइकियाट्री डिपार्टमेंट में। सो वहाँ एक मैंने टॉक दिया। और वहाँ ये जो क्वेश्चंस थे उनके काफी क्रूड थे। आप कितने लाइक आप इट वाज मोर लाइक जेंडर और सेक्सुअलिटी एक है, आप किसके साथ सोते हो एग्जैक्टली ये वो। सो हजारों क्वेश्चन थे, पर बट एट द एंड ऑफ इट मैं खुश थी क्योंकि मुझे सर्टिफिकेट मिल गया था। सो इट्स समटाइम्स इट्स, बट आई एम अब मैं इतनी खुश हूँ कि एटलीस्ट कुछ साइकियाट्रिस्ट इंडिया में जानते हैं कि जेंडर डिस्फोरिया क्या है, और ट्रीटमेंट कैसे, लाइक क्या प्रोसीजर है, प्रोटोकॉल है, एक्सेट्रा। सो एक क्वेश्चन आया है, व्हाट इज योर फ्यूचर प्लान फॉर ट्रांस पोर्टल एंड वेबसाइट। तो फ्यूचर प्लान्स अभी हमारा, तो एक तो है, हम यूट्यूब पे बहुत कंसंट्रेट करेंगे, और स्पेशली हिंदी कंटेंट में, क्योंकि मेरी हिंदी अच्छी इतनी अच्छी नहीं है, मैं साउथ की हूँ। तो काका की काका हो जाता है कभी, भूल चूक माफ। पर मोस्टली हम इंग्लिश में तो कहीं भी मिलता है, लाइक ट्रांजिशन के तरीके, हाउ टू ट्रांजिशन एक्सेट्रा। पर हिंदी स्पीकिंग पॉपुलेशन के लिए जो इतने एडुकेटेड नहीं है, उनको ये ट्रांजिशन के बारे में इन्फॉर्म करना, इस पे हम ज़्यादा फ़ोकस करेंगे। नहीं, ऐप पे नहीं करेंगे, सिर्फ़ वेबसाइट पे करेंगे अभी। यूट्यूब ऐप पे होगा। और ज़्यादा से ज़्यादा प्रोफ़ेशनल्स जो है, जो डॉक्टर्स एक्सेट्रा है, उनसे एक्सपीरियंस्ड पर्सन्स जो है, उनसे ऐसे टॉक्स अरेंज करेंगे। और थैंक यू। और अ, और उसके बाद कई 2-3 प्लान्स हैं जो जब थोड़ा मटेरियलाइज़ हो जाएगा तो हम बताएँगे। तो मेरा नेक्स्ट क्वेश्चन है जमाल के लिए। तो या सो ऐसे कई डॉक्टर्स थे जिन्हें आपको एडुकेट करना पड़ा जब आप गए वहाँ?
Uh, I think the gynecologist person and the surgeon person were the डॉक्टर जिनको मुझे खुद एजुकेट करना पड़ा कि
हुँ, हुँ।
क्या कैसे करना चाहिए और क्या एक्चुअली में प्रोटोकॉल है,
हुँ, हुँ।
ट्रांस लोग होते क्या हैं एक्चुअली में।
हुँ, हुँ।
बट खैर उनका सेंसिटाइजेशन ना नहीं हो पाया, दैट्स अ डिफरेंट थिंग।
Mhm.
सो
Yeah. Thank you, Rudrani. Thank you so much. Yeah. तो और जब तो सो या आपका कोई क्वेश्चन है मेरे लिए?
मतलब हाउ वाज योर ट्रांजिशन जर्नी, हाउ वाज इट बिन?
Yeah, my transition journey, only thing that was difficult for me was the family part because sorry मैं हिंदी में बोलना है जो मुश्किल था मेरे लिए वो था मेरे परिवार के रिएक्शंस बिकॉज वो मुझे मार डालना चाहते थे क्योंकि ऑनर किलिंग ये एक बहुत बड़ा इशू बन गया मेरे लिए कि वो मेरे जान के दुश्मन बन गए तो मेरे पापा नहीं मेरे इमीडिएट फैमिली नहीं पर एक्सटेंडेड फैमिली मेरे बुआ मेरे माय सिस्टर मेरी उनकी ब्रदर इन लॉ मेरे ब्रदर इन लॉ सारे मेरे जान के दुश्मन बन गए तो उनके लिए मैं एक कलंक थी और इस कलंक को मिटाना था उन्हें तो तो मुझे घर से भागना पड़ा क्योंकि वो ऑलमोस्ट रेडी थे मुझे मारने के लिए, तो मैं घर से भागी, पर भागूँ कहाँ? क्योंकि मैं जानती नहीं मैं काफ़ी यंग थी तब, तब इतना जानती भी नहीं थी। तो मैंने क्या किया मेरा एक फ्रेंड था जो कम्युनिटी से था वो एक गे आदमी था। तो उससे मैंने कहा अपने मम्मा का बुर्का ला मेरे लिए, मैं बुर्का पहन लूँगी। मुझे लाइक सो देन आई ट्रांज़िशन्ड अंडर अ बुर्का तो मैं बुर्का पहन के उसी शहर में एक दूसरे घर में सीक्रेटली रहने लगी और स्लोली मेरे पास कुछ पैसे थे जिसे मैंने कमाए थे तो उससे मैंने ट्रांजिशन किया और उसके बाद तो मोस्ट इम्पोर्टेंट थिंग ये था मेरे लिए कि मैं फैमिली से बच के रहूं क्योंकि वो मुझे अगर मैं कहीं भी दिखती हूँ उन्हें तो मैं यहाँ नहीं रहती पर स्लोली जब अ, जिंदगी आगे चलती गई मैं खुद को बिल्ड करती गई स्लोली ये जो फैमिली भी है वो मुझे एक्सेप्ट करने लगे एक एक जब दूसरी पीढ़ी आती है ना जब एक पीढ़ी थोड़ा ओल्ड हो जाती है और दूसरी पीढ़ी थोड़ी आवाज आ जाती है तो स्लोली ये थ्रेट जो था ऑनर किलिंग था किलिंग का वो कम होता गया और नाउ जैसे मेरी शादी हो गई है शादी सब कुछ यू क्या कर देती है पवित्र कर देती है इसका तो हो गया ना अभी सो दैट हैज पुट उसने सब कुछ सैनिटाइज कर दिया है तो नाउ एवरीथिंग इज हंकी डोरी सो दैट वाज माय ट्रांजिशन पर yeah it was a difficult journey but at the end of it एवरीथिंग इज वर्थ जो भी आप अ, करते हो सब कुछ वर्थ है जब आप खुद खुद अ, जैसा जीना चाहते हो वैसा जी सकते हो तो या दैट्स या सो जमाल uh, how did you connect to the trans men community in Delhi? Like you are quite a influential figure and in the trans men's community and you've done a lot of work how did you because a lot of trans people do not want to do anything for the community they just want because it's difficult
Yeah,
community it's difficult to even stand out and say yes I'm trans so how did you gather courage to be out open and say yes I'm going to do something.
आई थिंक जब मैं ट्रांज़िशन इन्फॉर्मेशन ढूँढ रहा था, तो मोस्टली सारी इन्फॉर्मेशन या सारे यूट्यूब वीडियोज़ बस सब विदेश के थे।
Mm,
एंड मैं डेस्परेटली ढूँढ रहा था कि कुछ इंडिया में मिल जाए, कोई तो मिल जाए, कहीं तो मिल जाए, बट कोई नहीं मिला। एंड दैट्स व्हेन आई सो एक इंसिडेंट था मेरी ज़िंदगी का कि जब नालसा जजमेंट पास हुआ था,
mhm,
तो आई गैदर्ड करेज और पहली बार मैं किसी एलजीबीटी इवेंट में गया था। एंड देन वहाँ पे भी देयर वाज़ दिस वाज़ ट्रांस पर्सन, ट्रांस मैन एक्चुअली, जो स्टेज पे खड़े होके बोल रहे थे, बट वो भी मास्क पहन के मास्क लगा के बोल रहे थे। तो
Mhm.
दैट्स व्हेन आई फेल्ट कि नहीं, इतना तो शर्म नहीं हो सकती ट्रांस में होने में,
Mhm.
इतना तो खराब नहीं हो सकता।
Yeah.
दैट्स व्हेन आई रियलाइज़ कि नहीं, कुछ तो करना चाहिए।
Mhm.
And that's when I started a YouTube channel, and then I started writing slowly, steadily, started doing all the work.
Yeah. Yeah. And uh, yeah, for me, it was very difficult to come out as trans because मेरे लिए बहुत मुश्किल था come out करना कि जब मेरा ट्रांजिशन हो गया उसके बाद मैं एक स्टेल्थ मोड में मैं चुपके से रह रही थी क्योंकि मुझे किसी को बताना ही नहीं था बिकॉज इतना ट्रॉमा था मेरे एंटायर फैमिली से मुझे कुछ नहीं चाहिए था एक्टिविज्म किसी को हेल्प करना कुछ ये बस जिंदा रहना था तो लाइक नाउ आई एम लाफिंग अबाउट इट तब काफी स्ट्रेसफुल था तो काफी ट्रॉमेटाइज थी मैं तो कुछ करना नहीं था ट्रांस कम्युनिटी से और उसके बाद स्लोली जब करना शुरू किया कुछ तो मुझे आगे नहीं आना था क्योंकि सिर्फ पीछे से कुछ ना कुछ लाइक इंटरनेट पे फेसबुक ग्रुप्स पे या व्हाट्सएप ग्रुप्स बना के एक्सेट्रा कुछ ना कुछ कर रही थी और जब थोड़ा थोड़ा आगे बढ़ता गया तो एक बार मैंने लाइक या मास्क पहन के कई बार मैंने टॉक्स किया है और हाँ प्रेस कॉन्फ्रेंसेस एक्सेट्रा मास्क पहन के ही किया था और स्लोली मास्क मास्क भी उतर गया सो एट एट वंस नहीं था ये प्रोसेस टू कम आउट एंड हेल्प द कम्युनिटी एक्सेट्रा एक्सेट्रा ये स्लोली स्लोली ही बनता गया क्योंकि इतनी हिम्मत किसी में भी कुछ लोगों में होती है कुछ हम मुझ जैसों में नहीं होती एट वंस टू कम आउट सो या तो या और अब कैसे हैं आपके घर वाले जमा
आई थिंक अभी भी उनका वो रॉन्ग प्रोनाउन चल रहा है,
हम्म
बट ऐसा नहीं है कि बिल्कुल ही एक्सेप्ट नहीं करना है, ये नहीं करना है, वो नहीं करना है।
हम्म
मतलब एक्सेप्टेंस है, बट वो एक्सेप्टेंस भी लेयर्ड होती है, तो उस लेयर में अभी थोड़ा बाकी है।
हम्म
एंड क्योंकि सो देयर इज अ रिलीजन एंगल ऑल्सो, कि माय फादर से कि मुस्लिम रिलीजन में इट्स सिन,
हम्म
तो वो उनका वहाँ पे रिजेक्शन हो जाता है।
हम्म
बट लेट्स सी।
yeah I hope things get better
या
yeah and uh, how do you what gives you hope for the trans community in a country like India
आई थिंक अभी तो ट्रांस कम्युनिटी के लिए लॉज आ गए हैं और काफ़ी
hmm
कुछ आ गया है। मतलब इट्स जस्ट अ स्टार्ट। अभी
hmm
नहीं, ऐसा भी नहीं है कि बिल्कुल सब कुछ अच्छा हो गया है।
hmm
अ,
I think there is Anna yeah
सो या, सो दैट व्हाट्स गिव मी होप। एंड व्हाट
yeah
अबाउट यू?
what gives me hope is that we exist you know हम अभी भी हैं अस्तित्व में ऐसे कई तानाशाह ऐसे कई राजा के ऐसे कई धर्म ऐसे कई जात आ गए हैं जो हमको पसंद नहीं करते पहले भी आए थे कई राजा कई डिक्टेटर्स एक्सेट्रा there've been a ton of dictators in the world there've been a ton of whatever religions in the world etc that has hated us didn't want us to exist also decimated us but still we rise from the ashes we come back no one can ever कोई भी कभी हमें मिटा नहीं सकता हम फिर से आएंगे फिर से उठ खड़े होंगे तो ये मुझे होप देता है क्योंकि जो भी हो हम कोई हमें मिटा नहीं सकता no matter how hard the dictator or whatever religion comes we will always exist and we will always uh, try to uh, ask more for our rights so I think that gives me hope the resilience of the community is something no one can kill so gives me a lot of hope. Yeah. And the younger generation, and the
Yeah.
younger generation, they are so fierce, you know.
Yeah.
When I see some, like everyone, they want more. They want more. They won't be silent. They won't take the shit that society threw on us, at least on them as well. So we somehow wanted to exist. They want to exist rightfully, and that gives me a lot of hope. Yeah. And yeah. And what do you have? Yeah, I think Dr. Richi Gupta is here. So let me just add her. Um,
Hi, Sahil.
no, no, Pramila Kalra. Hello, Dr. Pramila Kalra.
Hi, how are you?
We're good. We've been waiting for you.
Yeah, yeah.
thank, thank you so much for joining us and agreeing to do this.
Right, yeah. Thanks. No problem. My pleasure.
Yeah. I think Jamal has prepared a lot of questions for you. He's collected it from the community.
Okay.
So, yeah, maybe Jamal can start.
Sure.
Just
Yeah.
a second. Can you start? I
Oh,
think
yeah, sure,
I
sure.
don't have the access right now.
So, uh, one question that I have is uh, how can anyone make an appointment with you, either online or offline? And
Yeah, so
uh,
normally what we do is obviously we prefer to see the patient once first time. It's always better to have a one-to-one chat and meet the doctor once because somebody should see the patient, but sometimes the patients are staying in remote areas. So then it is not possible for the person to come directly to the doctor and they don't have access to the doctor. So now actually we are coming up with our consensus guidelines where what we are recommending is in case that you are unable to meet first time with the doctor directly in person, then what you can do is you can have one nearby doctor who is maybe not very much aware of the treatment of gender incongruence but actually can help us to make the to see the patient directly and then we can advise. That is another way of doing things. So that's what we are going to come up with the guidelines. So first visit we prefer in person first time when the patient is starting treatment first time. But if the patient is not starting treatment first time and is already on treatment, then we can do further online consults online only. But in person visit first time is necessary. In case it is not possible because the patient stays somewhere away or far off, then what we can do is they can have a local doctor. Local doctor can examine the patient and can help us to examine through online. The local doctor can directly see, take the blood pressure, see the weight, see the patient, and then after the local doctor has seen the patient we can go ahead with the treatment after we talk to the local doctor. So that local doctor can in a way act as a bridge for us to help us to take care of the patient better. The local doctor may not have much experience in treating gender incongruent. That's not necessary. They just have to do the basic check like blood pressure and all whatever we tell them to check, so that we are sure that we are doing the right thing for the patient.
okay, and this local doctor can be a GP, or do they
Can
have
be
to
a
be an
GP,
endo?
yes. Can be a GP. It need no. It is not required to be an endocrinologist. Can be a general practitioner or a family doctor who can help us to tell that basic parameters and vitals of the patients are okay and other things are fine, so that we are sure that we are doing the right thing for the patient.
Okay, and how do the patient make first contact with you? Through a telephone line, or do you
Yeah,
have a
yeah.
website?
I have a online consultation option available, so that through that we can do it, or we can do it through WhatsApp also.
Okay, we
But
can
it
share
has
them.
to preferably via video. Sometimes the patients don't want to their faces to be seen, so that's okay. Absolutely agreed. Otherwise, preferably it has to be a video consult. Yeah.
Okay, Jamal, do you have your questions?
Yes.
Yeah.
So at what age can we start HRT?
Only after the age of 18 in India. So in India, we cannot start before the age of 18 because what is the guideline is as far as possible, we don't start the gender affirming therapy before the age of 18. Before the age of 18, we can only give puberty blockers. Like there is an option to block the puberty so that the opposite gender changes don't happen, and we can give puberty blockers to stop the opposite gender changes. But we cannot start the the gender affirming therapy. That means the hormone therapy for the opposite gender before the age of 18 in India as of now. So that is the guideline we follow. So I treat only adults above the age of 18.
And what all are the documents that are required for starting HRT?
Yeah, so first and foremost thing is that we need to have opinion from the psychiatrist or the psychologist, clinical psychologist, not any psychologist, clinical psychologist, stating that the patient is fit to start gender affirming therapy, and the patient does not suffer from any other problem, because any other psychological problem or psychiatric problem can also be coexisting. So for that we want their opinion, because they need to say that there is no other problem existing with this. So the clinical psychologist or the psychiatrist need to certify that they are not having any other psychiatric disorder or psychological disorder. So once they certify that, the gender dysphoria treatment or the gender incongruence treatment can be started. But that is the first and the foremost step. After that, we have to do a set of tests. We have to check that whether giving hormones to this person is not going to cause any side effects. All hormones can cause side effects, but our purpose of checking is to see that by giving the hormone therapy, they are not going to get any harm. That's the first thing. Once we are sure that everything is fine, then we go ahead and start the hormone therapy.
So, can it be a clinical psychologist who gives the initial gender dysphoria
Yeah.
certificate, or does it have to be a psychiatrist?
It can be a clinical psychologist or a psychiatrist, but the many a times the clinical psychologists are not very sure. Then they say that we need a psychiatrist referral. So then we do a psychiatrist referral also. But in some of the places, what we do, like one psychiatrist gives the opinion, and then a clinical psychologist also talks to the patient. That helps the decision making capacity better, because it's not that it is mandatory, but it makes the patient's decision better. Patient should not regret later. That is also important, because many a times there are possibilities that we may not be able to make a correct diagnosis. So the patient may also not be able to make a correct diagnosis. So it is not wrong that the psychiatrist sees, and a clinical psychologist also helps. It is one actually for starting hormone therapy, either clinical psychologist or psychiatrist. But in case the clinical psychologist sometimes is not very sure, they do ask for a psychiatrist referral. So that's okay, because then it is always good that we do the right diagnosis and do the right treatment, and not hurry up for the treatment.
Um, and do you have a general idea how much will the initial consultation cost? Do you have, like, with the tests and all that?
See, that depends on the lab, but most of the time the initial test would cost around uh, if you go to an average lab, because each lab cost is different, each city cost is different. That is why it is very difficult to give a good idea, but approximately we can say between 2000 to 2500 it should be okay. That much maximum.
Thank you, doctor. Chima?
Yeah, you were also mentioning some tests. So could you share some tests that are required for HRT, for starting HRT?
Yeah, it depends on if it's we are starting male to female or female to male. So there are different types of tests which have to be done. If it is a male to female, then we have to check for glucose values, cholesterol values. We have to check for liver function. We have to check for a test called as prolactin. We also have to do the female hormone and the male hormone level to see what is the level at the baseline. We are also supposed to do a karyotype at the baseline, but most of the times we don't do the karyotype. But as per the recommendations, we are supposed to do. And also, if there is any other coexisting illness, we have to check, like thyroid and all, we have to see. If it's a female to male, then we have to again check for cholesterol and glucose values. We also need to check for hemoglobin, because there may be a rise of hematocrit. We need to check that as well. And then we check the female and the male hormone level, that is the testosterone and the estradiol levels. We also need to check thyroid if case it is any borderline or abnormal. And again, as per the patient's other comorbidities, suppose patient is a bit older, we might advise for a cardiac evaluation as well. And along with that, karyotype is actually recommended, but most of the times we are not doing it. In case it is absolutely necessary, we do it.
And what all the changes people can expect out after HRT?
So again, it depends on male to female or female to male. So first I'll say male to female. If it's a male to female, then first of all, after starting the gender affirming therapy, they will see some reduction in the hair growth over the body. So they will see that their beard growth or the mustache has started growing less, little bit, and then they may see a change in the texture of of their skin, the distribution of the fat. But again, to add, all these changes take time. They happen over a period of 3 to 6 months. It's not like initially only 1 day or 2 days we'll see. It takes a lot of time, but 3 to 6 months is the initial period when they start seeing some changes. Then obviously, if it's they may start seeing some breast development later over a period of time. And initially the skin changes and the hair growth changes are more predominant, and the distribution of the fat, and they may feel little bit low. Mood swings may also happen because we give therapy to reduce the male hormone level and give female hormone from outside. So they may feel, get some mood swings, and they may feel fatigued little bit initially, but over a period of time, most of the times it settles down. But if it is becoming problematic, then we tell them to take a re-opinion with the psychiatrist and again decide on the dose modification.
And related to that question, I also wanted to ask. There are a lot of people who ask, ki, "Will I change emotionally once I start HRT?" Does
Not necessarily, because everybody may not have these type of changes. Some patients may feel some mood swings, some patients may have some emotional changes, some patients may not feel the same. Yeah. So there may be some changes. Sometimes some patients may get feel depressed, some patients may feel very good, sometimes there may be mood swings. So all these changes do happen, but it depends on a case to case basis. So we have to see the patient, see accordingly, and take a call.
okay. And is there any side effect of HRT? Uh,
Yes, there are lots of side effects, and that's the reason these tests are being done. So, whatever test I have detailed, these tests are being done to follow up. So, after starting the gender affirming therapy, we do a follow up test after 3 months with for both male to female and female to male. For female to male, we do the hemoglobin, the hematocrit, the liver function test. We also check for glucose values if it was borderline in the beginning. If thyroid was borderline, we check it on follow up to see if they are getting any side effects. For male to female, we do glucose and lipid levels, we do prolactin, and in case there are some other things which were abnormal, we repeat them because we need to monitor the side effects. So first time we do after 3 months, then after 6 months, and then at least once in 6 months we prefer to continue doing it so that we can catch as and when the side effects happen and modify the hormonal dose accordingly.
Uh, if I may ask here, what if a patient has to look for something going wrong in them? Is there anything that you see that it would tell the patient that, okay, look for some
Yeah,
sign?
so yeah, if we start like for male to female, where we start estrogens, we tell them that you let us know in case you have any nausea, vomiting, abdominal pain, main problems, headache, leg pain, because these can all be markers where we need to evaluate or give a maybe a halt the therapy at that point of time. And if they get any severe nausea or jaundice, they have to report to us, or abdominal pain, or even headache also. And when we are talking about female to male, we know that if we tell them that if they have any again headache, or because sometimes there can be a rise in hematocrit, there can be polycythemia, and they may feel headache, they may continue to smoke. The smoking is very harmful, so they should never smoke when they are taking gender affirming therapy. And they should report to us immediately if they have any of these problems, or any jaundice sets in or anything which can be suggestive of liver side effects. They have to report to us immediately.
Also, after HRT, can people freeze their egg?
See, normally I tell all my clients to freeze their eggs in the beginning before they start the HRT, or the sperms also banking has to be done before they start the HRT. But many a times it happens that they don't want to do it at that point of time because of financial constraints, most of the times, or family issues, or they want to immediately start the hormones and then decide about it later, or at that point of time they are not in a position to decide about it. So what I tell them is, like, if in case you have already started the hormone therapy, then what we do is we stop the hormone therapy for some time, for 2 to 3 months, and then we do the test, and then we do the sperm banking and the ovum banking, and then restart the hormone therapy. That is another way out. But at that point of time, sometimes retrieval of ovum may become very difficult, and it is always advisable, if you are wanting to do it before you start the hormone therapy. That is the best time to do it. Don't delay. In case you have financial issues, you are not able to do it, or you have already started and now you want to do it, then we hold the hormone therapy for some time, 2 to 3 months, and then we do the ovum banking or sperm banking as per the case.
And do you connect people to sperm banking and ovum banking
Yeah, in
facilities?
Bangalore, yeah, Bangalore, we have in our own hospital also facilities, and we have facilities in other hospitals as well. So we do tell them, we give them the address. We don't directly contact on their behalf. We tell them the address and give them the liberty to go there and get it done.
And do you have a clue how much does it cost in
That
Bangalore?
also approximately differs. So for me to tell the cost would be difficult because I don't directly deal with it. But in our like for 3 years, around 75,000 is an approximate cost. But it differs again from city to city.
Okay,
So
thank you.
Also, a lot of time in trans men we hear that hysterectomy करा लेनी चाहिए after HRT. Is it necessary to do hysterectomy after HRT?
nothing is necessary. So it is all dependent on the patient what they want to do. There is nothing forced on anybody, and there is no necessity of anything. Whenever they decide, they have to take a call. Only thing is, in case they have not done the hysterectomy, they have not done the oophorectomy, we need to follow them up, and we need to do the monitoring for any of those cancers later as per a normal woman, so that they should not forget. Because what happens, many of my clients have not undergone any surgery for years, so they need to be very sure that we need to follow them up for the complications of a woman also, for the cancers. So that is very important, because suppose they have a uterus and ovaries inside, then even if they are taking testosterone, the uterus and ovary is there. So that monitoring is required. We need to see with the ultrasound if anything is happening, any problem is happening with the uterus, even though they are not getting their periods, but uterus has to be monitored. So that is why ovaries have to be monitored. So as per the normal woman, what we do, we need to do for them. If they have done the surgery, then we don't have to do. So it's not mandatory that they have to do. It is the patient's decision what they want to do, but they have to discuss with their doctor individually, and the decision has to be taken accordingly.
So there are two injections that are suggested. Is there any difference between them,
For the male to female or female to male?
female to male?
Yeah, so there are different brands of testosterone available. We have different brands, so both brands work. We also have options of gel. We give these injection once in 3 to 4 weeks. Initially, we start once in 4 weeks, low dose, 100 mg. Then we increase the dose slowly over time to 250 mg after monitoring for the side effects. So we go with 100 mg and then we increase to 250 mg. And also we have a 1000 mg injection, but we normally don't prefer this because with 1000 mg the side effects are higher, which is given once in 3 months. But sometimes the patients prefer once in 3 months because they can't get access every month. The gels are also available. Some of the patients who have got side effects or liver side effects with the testosterone injections, I use gels also. So there are options of gels which have very less side effects, but they have to be applied daily, and little bit of the cost factor comes into play. So that is another option for them. So all these things work. So it has to be again individualized and decided as per the follow up of the side effects. For females, we use only tablets. We don't have the estrogen injections as of now available in the as of now is not available. So I use patches, estrogen patches, or tablets for females. There is another injection called as leupride injection, which is given for reducing, like when we are giving to females, for male to female we are giving the estrogen hormone. We, to reduce the male hormone, we give an injection leuprolide, which is to reduce the male hormone level. So that can also be given, but sometimes the patients don't opt for that and they want spironolactone, which also can be given, but it is little bit less effective than leuprolide. Leuprolide is more effective. It reduces the male hormone levels nicely, and then the estrogens work better.
Okay, so the spironolactone can still be used if the
Yeah,
patient cannot afford
I
it.
do use. We use with estrogens and spironolactone for those patients who don't afford the leuprolide.
Okay,
We
thank you.
use it, but we have to monitor the potassium and we have to just keep a watch on potassium levels.
Sometimes patients also mention that there is extreme hair loss. So, is it is because of HRT or something like that?
No, only gender affirming therapy is not the cause of hair loss. We have to see for the reasons of hair loss. Sometimes there can be multiple vitamin deficiencies. Sometimes it can be genetic. Sometimes there can be some illness which is the cause. Sometimes it can be thyroid problem which can be the cause. So first we have to investigate the cause of hair loss. If we don't find any other cause, then gender affirming therapy, if it is the cause or it is causing it, then accordingly we have to decide about the management. So it has to be again individualized. We cannot have a generalized statement on the hair loss. There can be many reasons ranging from nutritional deficiencies to genetic factors to the hypothyroidism to many other reasons. So which all have to be evaluated and we have to accordingly give the treatment for the hair fall.
Nisara, do you want to ask the audience questions?
I have a few questions, one or two. So, in India, the endocrinologists do not usually recommend injections, even when they were available. So, are there risks associated with injections that is difficult to manage?
You are talking about estrogen injections?
Estrogen
No,
injections, progesterone.
we were using estrogen injections. Not that we were not using, but now it is not available. The
Okay,
safest is the patches. The
okay,
injections and the tablets have almost similar side effect profile. The obviously with injection with one go we go with the levels become very high. So obviously the complication rate may be a little bit higher, but the least side effect is seen with patches because they avoid the hepatic first pass metabolism. So patches are the safest to be used, though in some situations the patches may not be very comfortable for the patient, like if the humidity is very high, the weather is very hot, the patients find that the patches come out. Otherwise patches are the safest option. They are a little bit costlier as compared to the tablets, but if you ask about the safety and the least side effects, I would recommend patches. But yes, I agree that in few climate situations it is not possible to use patches, so we use tablets, but injections as of now are not available, so we are not using them.
and patches, are they available in India?
Yes, they are available. In Bangalore, they are available. Most of the cities, they are available. Some of the cities, they are not available as of now. But once in one or the other pharmacy, you will get it because in India, it is available now.
Okay. And are these patches the ones that are imported from UK, or are they just
Yeah.
show so?
Yeah, they are manufactured. Like one is the one which is imported from UK, and there are some which are in-house manufactured also.
Okay, all right. Yeah, sure. So I have a question about uh, bicalutamide versus
See,
pyro.
bicalutamide has liver toxicity. At the moment, it is not recommended in any of the international guidelines to be used for the treatment of gender incongruence. So that's my answer. Don't try something which is online on Google, which is not yet approved. Don't try. The incidence of hepatotoxicity with bicalutamide is high. So at the moment, the guidelines are not recommending use of this over spironolactone. So as of now, if you see, even the international American guidelines are also recommending the use of spironolactone, and that is why we use spironolactone if the patient is not affording leuprolide.
Okay, thank you, doctor. So there is another question for MTF transition. Will I be taking estrogens for rest of my life? I've heard that FTM men are required to be on testosterone for rest of their life.
See, what we do is when the my first answer to this is like we don't have much experience anywhere in the world with the longest treatment of testosterone or estrogen. So these things are coming up now, and for 20-25 years is the experience which people have. So the thing is that what the recommendations now are is for female to male we can continue testosterone, though maybe after the age of 50 to 55 we are suggesting that we can reduce the dose of testo like it happens in a normal male. So in a normal male, once they grow older, their testo levels anyways come down. So what we are recommending in the latest Indian guidelines now is, because we recently made the consensus which is going to come online soon, so in that we are recommending that the testo the dose can be reduced as the age advances for a male, because in male this is a normal physiology which happens. For females, what happens? There is a menopause. So at that time, the estrogen levels go down very low. So what we are recommending is after the age of 45 to 50, we normally plan to stop in male to female, because at that point of time, this is a normal physiology which happens in normal females also. So this is the reason behind these two consensus. You're muted. I'm not able to hear. Yeah.
Thank you, doctor.
Yeah.
So there's another question. My hemoglobin level is low. It's 9 only. So how can I increase my hemoglobin?
So first of all, we have to see that why the hemoglobin is low. There can be the commonest cause in India for low hemoglobin is worm infestation. So take treatment for worms. Go to a meet your local doctor first. Take in treatment first. We have to check what is the reason of the low hemoglobin. We have to check your ferritin levels. We have to check your vitamin B12 levels. We have to see your peripheral blood smear. We have to see the type of anemia. We have to do the blood parameters MCV, MCH, and MCHC. By that, we will know what type of anemia it is. Once we know the type of anemia, we know if it is low because of iron deficiency, we give you a deworming treatment, we give you iron tablets. If it is because of vitamin B12 deficiency, which is very common in vegetarians, we give you vitamin B12 injections if needed, or vitamin B12 tablets. And then over a period of time, the hemoglobin should improve. If it is because of some other reason, then that cause has to be taken care of. Sometimes there are some gastric ulcers which are causing gastric bleed and leading to anemia. That those reasons have to be seen and treated.
Okay. Um, so I also have a question, which I hear from a lot of trans women that in these days there are some peritoneal surgeries for trans women, and they use estrogen creams on the peritoneum to for the metaplasia. Do you have any opinion on that?
At the moment, those things are not recommended. These are all being tried. There are so many things being tried in the world. But whenever we talk about treatment or whenever we talk about management, whatever is authenticated and proven to be safe is to be practiced. The basic dictum is first do no harm. That is the basic dictum. The second dictum is after that only we go ahead with the next step is do good. First, do no harm. So, no harm means we should never try experimental therapies. These are all being things people have been trying, which have been there in the world literature, but nothing has come into the guideline at the moment.
Okay.
Yeah.
And I also have a question, that is, does HRT require any lifestyle changes like quitting smoking, drinking, exercises, etc.?
HRT definitely requires lifestyle changes. It's not only HRT which requires lifestyle changes. No smoking and alcohol is the first dictum. It should not be taken, no matter you are taking HRT or not taking HRT. For anybody, smoking and alcohol is harmful. There's no controversy. And if you are on gender affirming therapy, it's going to even harm you more if you're smoking or taking alcohol. So there is no controversy on that question. Coming to the lifestyle, yes, everybody, every human being has to do lifestyle modification. They have to follow exercise, they have to go for a walk, they have to take healthy diet. So again, there is no controversy on that. So even if you are on gender affirming therapy or you're not on gender affirming therapy, you have to follow lifestyle. You have to not do smoking, and you don't have to take alcohol. That is the most important thing.
Okay, thank you, doctor. Um, I uh,
Can I ask one question?
yeah, yeah, please, Chima.
So there was one question on Instagram that sometimes it happens that even in HRT, people bleed. Menstruation happens.
Yeah.
So
See what happens that when the testosterone dose is low, initially 3 months to 6 months, the periods may come, the menstruation may come. But after that, most of the time it doesn't come, it stops. But it happens that for some people, there may be a bleeding later also. Suppose they delay the next injection, or for some reason they have skipped the injections, they may get a breakthrough bleed. We have treatment for that, but another important thing is it's not the treatment only. The first thing is if for some time the periods were not coming and all of a sudden they have started bleeding, we should investigate that. We should do an ultrasound to see what is happening. because we should not miss some problem also. So that is why, if in between the periods were not coming and all of a sudden they have started coming again, and in spite of the hormone therapy being the same and the dose not being reduced, then it is better to check and see what is happening. And that is one thing. And then there are treatment available if there is no other reason and it's just that it is just coming like that in between. Then we have therapies available in the form of medroxyprogesterone. We have injections, depo-provera and all, which can be given to stop the bleeding. Even leupride can be given, leuprolide can be given in such cases.
I have a question. Can someone start HRT in their late 30s or early 40s?
Yes, they can start. I have a lot of patients who come to me at that age. But as I told you, if you are older, then we have to do more tests to check that everything is fine. Once we are satisfied that everything is fine, you don't have any other problems, then only we start. So we do maybe do a cardiac evaluation also for you, a basic one, not a very stringent one. And we may do anyways glucose and cholesterol testing, everything we do anyways for all. But we may do more set of tests to see if there is anything which can cause any harm to your body, and then you can start. In case you already have some disease like diabetes or something, we might wait for the disease to be controlled with medications. So first we will control that with medications, and then we add the tablets and or the HRT or the gender affirming therapy, then we can give it. But we have to definitely see that you should not get any harm out of it, so we do a basic evaluation.
Okay. Another question is for countering the effects of drop in libido and cognitive decline with HRT for MTF. Do you do any sort of microdosing of testosterone or thing?
No, male to female, you are talking about M
Yeah,
to F
male to.
microdosing of testo. No, 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 no. That we don't do. So the thing is that when a patient is like, if suppose they are on male to female and they are on estrogens, then we don't do any microdosing of testo, because some amount of testosterone levels, if they have not done the surgery for the orchidectomy is not yet done, then they have some amount of testosterone obviously there. It's not zero, so we don't have to do any other further dosing of testosterone on top of that. If there is anything happening with the cognition, then we have to obviously check if there is any derangement happening with the cholesterol or the glucose values. We have to treat that. And we have to see that the patient is not getting any side effects. So if there is some cognitive decline happening or some problem happening with the brain, then we need to check and see for any other cause. And in case there is nothing else, then we just continue with the estrogens and the therapy for them. If they have already done the surgery and the orchidectomy is already done where their testosterone levels are almost zero, so in those cases also microdosing of testo is not recommended as per the guidelines.
Okay, thank you, doctor. And do you recommend orchidectomy over anti-androgens over a long time?
No, it's not like that. Again, I we leave it to the individual, because there is no set of criteria that we have to force them to go for surgery. It all depends on the person, what they want to do. We, if they have not done the orchidectomy, we can give them, as I told you, leuprolide to control the male hormone levels, and we give them the estrogens from outside. In case they have done the surgery, then we only have to give them estrogens. So we don't recommend that they have to go for orchidectomy for this. Obviously, if they do orchidectomy, their male hormone levels almost become negligible, and with the leuprolide it may not become, it may also come down, but not to that level. So that way, some people want almost negligible levels, they go for orchidectomy. But not all my patients go for have gone for orchidectomy. Some of them have not done it. So it's their choice, it's their personal decision.
Okay. So there is a question. My testosterone is very, very low, but my body is making more DHT.
You don't
That's a
have to
question.
worry about that. You don't have to worry about these things. Don't go into the things too much. There's nothing like that. If your testo is low, your DHT will always be low. So don't try to check and see, because we can get all types of values and you can get more confused. So if your testo is low, then we just have to uh, uh, if your testo is low, you just have to take the estrogens what you have been given, and the effects will show. Don't worry about it. Don't worry about these DHT and all.
I don't know if we have one more question. Is stopping libido possible only with HRT? Uh,
That depends. See, there are a lot of factors which depends. It's not only one gender affirming therapy which is the cause. So there are emotional factors, there are mood factors, there are family factors, there are social support system, peer factors. So it's not one factor for this. So that all we have to see for the individual patient and then take a call. Many of my patients do suffer from depression because of being deserted by their families and friends, or facing discrimination at the workplace. So all these problems are there. So we have to see individual factor and sort it out.
Okay. Uh, I teach at a college. Does management or high authority have powers to prevent me from beginning my HRT? Can they ask me to leave? No, I think. Yeah, can they ask me to leave my job in case I publicly declare my desire to transition? I think.
As of the guidelines or as of our government rules, they cannot. But see, the problem is in India, it's such a vast country. There are many people who don't understand about it. So the thing is, we do see a lot of our patients facing discrimination at workplace, which is very unfortunate, but it does happen. So the thing is, we have to go and talk to them. You have to take the people who understand your thing into confidence, and maybe you have to take some higher authorities in your field with you to talk to them, because you need to talk to the people. If you talk to them, explain to them, then things can be sorted out. So it is this thing which has to be sorted out first, rather than going and fighting, because there are people who don't know about it, and there are people who don't even understand about it. So all of a sudden their reaction will be like that, what you are expecting. But that is not the right reaction. As per law, no, they cannot do any discrimination against you. As per law, no. But the law may not always be there. There may be people who may not follow, who may not understand. So we have to talk, we have to have amicable solution to it. That's what I tell for thing. Don't go and just fight. Just go slow, give time to them, because people need time to understand. Once they understand, they know that this is not something which is out of the blue. This is something which is there in our society. Only they didn't know about it. That's it.
And a question about medical fraternity. Is there any sort of uh, n- um, training for upcoming endocrinologists happening to to provide gender affirmative care?
Absolutely. We have actually included now this in the UG curriculum. So even in the new undergraduate curriculum, forget about endocrinologists. Endocrinologists will 100% know about it. But we have told, and we have been trying, and it is going to come in the UG curriculum also. Undergraduate, when they join MBBS, they will be taught there also. So from there on, this chapter will start, and now we will have transgender teaching starting from the UG curriculum to MD to DM. And all our endocrinology trainees do know about it. They attend in all our endocrinology conference. We have a session on transgender medicine, and we do discuss. And all our postgraduates who are doing DM under us are taught about the gender incongruence. So they are all aware.
Okay. There's another question. I don't know what it means. It's just male pattern baldness on lupride. I don't.
So that see, the male pattern baldness is not just the reason, because the thing is that, when, as I told you, if there is a male to female, so if it's a male to female, they may have the holandric gene. They may be anyways predisposed for male pattern baldness because of their genetic makeup, because the chromosome makeup is XY. So when we are doing from male to female, we do give estrogens and we do give leuprolide. And if the hair fall is continuing, we have options. Sometimes we do give finasteride, but it may not help for all patients. But as I told you, it's not only sometimes which is the cause. There may be some other reasons which may be the cause. So we have to find out the reason and treat that. In case there is something which is not treatable, like holandric gene, then, or it is familial, then we might have to think about other options and discuss with the dermatologist. So basically, a gender incongruence treatment is not only done by the endocrinologist, but it's a teamwork with the psychiatrist, clinical psychologist, with dermatologist, ENT, all these people, and urologist and gynecologist, all these people help us. So a dermatologist opinion has to be taken, and we have to take a call what to do best for the patient.
Okay. I have one more question. In case someone who's minor wants to access blocker, what kind of pre-evaluation, or what kind of permissions or like what kind of documentations will they need with them?
See, that's a very difficult question at the moment in our country, because we don't have very clear cut guidelines. So, most of the colleagues who we are working with or who are treating transgender, are not very clear about what we are supposed to do. As per the international guidelines, we need a consent from the parents also. That is what we need. And we need to check their bone health, we need to check their glucose, we need to check their lipids, we need to check their hormone levels, and we need obviously a child psychiatrist counseling. But most of the child psychiatrists are not very comfortable in dealing with this at the moment. So it's a very gray area at the moment. So till we have some very clear cut guidelines, which is soon going to come within a year or so, we may be in a better position. But at the moment, like people like me, we I treat only adults. So I treat only after the age of 18. Below the age of 18, most of the times the children are brought, but the parents don't want any intervention. Most of the time, that is, I have kids who come to me who are brought by the parents, but they don't want any intervention, they just want to wait till the age of 18. So that is what most of the parents have decided. So because the parents consent is also needed, most of the times we are not able to do any intervention, and we don't have very clear cut guidelines. It's more of a gray area in the country at the moment, but internationally this is what I told you.
Thank you very much, doctor. I think Jamal, do you have any questions?
No, not.
Yeah. Thank you very much, Dr. Pramila Kalra, for helping us with this talk. It has been really, really enlightening for all of us because, especially because we are a community who does not talk to doctors, and there is so much of misinformation, and we sometimes half bake information that comes to us. So,
Correct.
this was really helpful for us.
This, I would like to just say one thing, that always trust your doctor and go to a person who deals with transgender, who understands, because I understand that all doctors may not be comfortable dealing with it at the moment, though we are trying to spread more information through CMEs and all to make them understand at least. And as I told you, like now we are going to come up with the guidelines that first consultation we always would like you to go to your family physician or nearby doctor, and so that we can just talk to them and give you the right treatment. So there are doctors available who are going to help you. But if you have a doctor who is just comfortable enough to give us the information with the basic parameters, so that we don't worry about treating, because sometimes we are worried in online consults that I have not seen the patient also first time and I'm giving hormones if some side effects happen. So it's always safe for you as well as for the treating endocrinologist to take a call on that. Follow the endocrinologist orders, don't take overdose, don't worry. The effects will be slow, it will not be very fast, we always go slow. And lifestyle modification, avoidance of smoking and alcohol is very important. And I always suggest that keep your family with you. Always see that you talk to them, because parents may not understand it very fast, they may need time, so but give them time to understand. Don't be very fast with the things, don't try to rush up, because I get people who tell me that you start hormones today, tomorrow. I tell them no, it's not like that, go slow. Let your parents be comfortable with it, let them get some time, a month or so, take decision about ovum banking or sperm banking respectively, whatever the case may be, because that is one thing which always the parents would go for and would worry about, and then take your call for the hormones. So go slow, don't rush up with things. Things will fall in place, but you just have to go slow with the things, that's it.
Thank you very much, doctor, and have a nice evening.
Okay, thank you, good night
Okay.
everyone, take care, bye.
Bye.
Bye.